Training.
Continue with your item. Are you done? Thank you so much for the clap for the young ones.
Mubaka kole management no bangwende a committee balete shambwa. E shamba sibana leta twabere serete. Any mistake ya mahambo mundu ikamuluma koze ne doctor. Omubati mwambo sehare. Nero emkechi kola muti nyinga management a committee area hamba abantu balete shambwa esigalo chabarongera ebwera chitulu chidodo kasese. Betu mubati sehare noju no muwuma. Betu njembo ya bare nyeluma kanda singa wote na doctor ewa bare nyekola kuno mundu noju na muwuma.
Tatukanja muika kuluma.
Muika nyeluma hano nebironda bisatu amenwa satu.
Baire kuluma yitu.
Ngale mninga hambayo na ngale tayo kwa chikatu kukoba ya tusobara kulete shamba sho kwa chikatu. Ngama hambi pichi kundembo ya mabere nyiluma na mwesi yaba na bana musirete kwa bugere niko basirete okwata unikasu kutsugora Rwenzori square basitele bekatu. Bitana manga ikahanu bamanyi abadokta baranya hama ngende kwa taunikasu na manga ikaku sekole mubatsi. Na manga taunikasu mamujinga ende rukochi. Ngatuna ike rukochi na masuba hano ngasenga minye. Ibo bali bakakolomba munga nonuyu esahare echikatu ene select mistake kuti echindu cyose cyangabya embo ya maluma mu doctor yekamuhamba yekamuluma ebakechikola bati omubatsoli obanyanza ende eshambwa sikendolo mabandu baserete kuziyengene haluma mundu nyekwa ebukese boti mubatsi oyo golukuchi nganzi yenge bambo mubatsi owakaya nyitwitinga ngabyende because nyembo ilu ineka ese yute botsebu ngaboti mama ngaletayo kwa chikatu siri anyeluma
ebo ere kulumani yawo
ni yayo
ama naona wenda
Mmesu Matias
ewo onayo
ewa ni mwachidondo ama nawe business bakama tamu doctor bicha bya mbuzi.
I'm a senior veterinary officer at the Ministry of Agriculture, Industry and Fisheries. I'm the focal person for rabies control at the ministry. And here, this function, I'm also representing the Commissioner of Animal Health, who's in charge of animal health in the whole country. So we are here to commemorate World Rabies Day. World Rabies Day is a day that is set apart by the Global Alliance for Rabies Control internationally. It is commemorated everywhere internationally as a way of raising awareness. We raise awareness through the year, but this is the peak to raise more awareness about rabies and to see how different stakeholders can work together to fight this horrifying disease. Raise awareness about its cause, its transmission, its control, and how the community can also participate in the control and eventual elimination of rabies.
Doctor, you did talk of
that because when you're recording a case, you document which animal has bitten them, the site where they have been bitten, and whether the animal is still there, to trace it and maybe confine it and see whether it has rabies. And if it dies, to refer the sample. So it's a process. So through that reporting, all over the world, it was realized that 99% of the cases, it is dogs that are biting. But even the other 1% is still there, it is big, but we want to first target this one, which is the biggest. Yes. By a suspected rabid animal, you're supposed first of all to know the first aid. The bite wound is washed with a lot of running water with soap. You really wash to reduce the virus load. Then after that, you go to the health center and request for that to be vaccinated, to be treated. It's not a one-off. You may have to get 4 or 5 injections, but at different intervals.
Lastly, your name?
Dr. Nakaja Maria Flavia, Senior Veterinary Officer from the Ministry of Agriculture and Industry.
we can vaccinate more animals, as this will even improve our PDM program. We are ready to do that as a district. That's why I have called my friends, the honorable members of council that monitor government programs, to give this testimony that we are ready to serve the people of Uganda as per the manifesto of our dear His Excellency the President and the NRM chairperson and the President of this country. As political leaders standing in front of you, Bwana Chief Guest, I want to promise that we, as political leaders, the production department, the production committee, on behalf of council, we are going to work with MAIF and other development partners to vaccinate the 92% dogs remaining. We were told a few minutes back that only 8% has been done. 92% is yet to be completed. I want to, on behalf of the district, request MAIF, Ministry of Health, and even the development partners, since you are here, please give us a hand, give us the vaccines, and then we move to vaccinate the remaining 92%. It's still a big number, but with your support, we can do it. Essential drugs that keep coming, we need to give a budget, we need to put a budget under Ministry of Health so that these drugs for fighting rabies can come under essential drugs, so that our people can get them freely. Otherwise, on the open market, the vaccines and the drugs for rabies, a chikatu chiuma or one injection or a vaccine is 70,000 shillings on an open market, and 3 doses that are needed, that's 210. This is very costly, and our wananchi cannot afford it. That's why I'm requesting that Ministry of Health to do the budgeting so that we can get the medicines through essential drugs program. Ministry of Health should therefore do us the needful. I hope you are going to take the message since we are implementing One Health approach. I call upon everyone who keeps a pet, a dog, to maintain good sanitation practices, as this will help us keep stray dogs. Let us keep the dogs we can manage. Let us report immediately to the health facilities and veterinary officers if our family members have been bitten by dogs or cats. For proper management, we have been guided, and as political leaders, we shall monitor this through our structures at lower local governments. We shall take the education further down so that we disseminate, firstly, the strategies of eliminating rabies. Special requests. I want to request on behalf of Kasese District Local Government that we could have a dog clinic in the district. If we can have a dog clinic, if it can come periodically, if it can be mobile, we shall be very thankful. But if it can be permanently built through MAIF and the partners, we shall be very, very grateful. We have written several letters, Bwana Chief Guest, to the Ministry of Agriculture, Animal Industries and Fisheries to allocate us 250 acres of land to our youth and the women in the Mubuku irrigation scheme phase 2, so that our youth and women can access this land and till it, as this will also help us do a lot of agriculture, a lot of irrigation farming, and even improve the PDM. I want to thank everyone who has come, and I want to say, my honorable members, because of time, would mention where they come from, but
they can wave to us.
They can wave. Can you wave to the people so that the people know you are here?
Yeah.
For God and my country, Habwa Kahingo no Singabuku etu na Mashiyara Ninge District Vice Chairperson.
Thank you so much, Mwalimu Mande. Can we?
Ladies and gentlemen, I'm Lieutenant Mate Magwara, Deputy RDC Kasese. My senior Lieutenant Joy Walusi couldn't be here due to other official duties. First of all, I want to welcome you to Kasese, and I want to thank you for the choice of Kasese to host this function. Honorable Minister, before I invite you to speak to the audience, I only want to make 3 raise 3 points very briefly. First of all, to urge our community to embrace the culture of using dogs for security. Dogs for enhancement of security, especially in homes and also to guard properties. They are very effective, but they need to be well fed and well cared for. Number two, I would like to thank the organizers for inviting these children, although they invited few, because the last census results indicated 50.6% of our population is of the age group between 1 day to 17 years of age. Now that is the present Uganda, that's the future Uganda. Those of us who are my age, who are here, I do not know how many will be around in the next 30 years. And even if you are around, chances are higher that we shall not be very useful or helpful. So the people to plan for, the people to think about are these young ones. And it's very positive that they have been actively involved in this function. Lastly, I would like to welcome the many guests from the various other districts that are here. I listened when it was time for introductions. Dr. So-and-so, Professor so-and-so, so many. I want to thank you for coming. But I know that there are several of your colleagues that may not have come for fear of floods, for fear of ADF. I want to remind you that the story of Kasese is now different. ADF is gone, long gone. Floods came occasionally, including last week, but they are not cause for you to fear to come to Kasese. Kasese is writing a more positive story than the story of scares of the past. So tell those you left behind that Kasese is a place for us to even visit in the next vacation. Christmas is about to come. Visit Kasese. Kasese is a place that, as you have been here now, I'm happy for over a week or around a week. I'm sure you will go back with a different picture of the Kasese that you have seen from the one that you came knowing. So welcome again to Kasese. During your stay here, feel free to visit anywhere. The end of this function does not mean you are sent away from Kasese. Take your time, visit. There are so many attractive tourist destinations in this area. With these few words, I would like to invite the Honorable Minister to speak to the audience. Thank you very much.
Muneyo, even those who came, you should have at least learned how to greet. When you reach somewhere, the first thing you should learn is how to greet. But otherwise, all of you, thank you very much for coming. The RDC, the DC chairman, our FAO representatives from different ministries who are here, culture, health, and our representatives from agencies of government, NDA, and others, all development partners. I'm Kabyanga Godfrey Baruku. I'm State Minister for Information, Communication Technology, and National Guidance. And I happen to come from Kasese. I received this invitation to attend this function about a month ago in my own capacity as a leader in this area. I was invited by my veterinary doctor, who has been my personal veterinary doctor for about 15 years now, Dr. Kibaya. He rang me and told me they have offered him a slot to hold World Rabies Day in Kasese, and he would like me to be there. And I told him around that time I'll be there for World Tourism Day, so I will come by. I didn't know that I would be a guest of honor, but I was invited as a leader, and even if I was not a guest of honor, I would have attended to honor my friend, long-time friend. So I bring apologies from my colleagues from Ministry of Agriculture. The ministers, actually the Ministry of Agriculture was supposed to be the guest of honor. But you know, Kampala is also hectic. There are so many functions. And I think at the last hour, none of them could make it to Kasese. But they communicated to me, and since we serve the same government, I had to step in immediately as a guest who had been invited before, and also to step in and represent government. So you shouldn't worry that the Minister of Agriculture is not here. I'm here to represent the whole of government. We ministers always have challenges. They write for us speeches. But this speech is very long. I'm not a man of very long speeches. So the paparazzi who need the speech, I will give it to you. After all, some of the things which are here have already been spoken about. So I will be as if I'm repeating so many things. But this is the official speech from Ministry of Agriculture, which I may not go through verbatim. So as a leader in this district, let me thank you all for coming to Kasese. First of all, for this very wonderful exercise, but also for coming to Kasese to experience the new Kasese. The new Kasese. No, Kasese is always in the news for the wrong things, but now it has started appearing in the news for the very good things. We now have the Rwenzori Taskalite Marathon, we have the Rwenzori Teluja, now it was World Tourism Day. Today it is World Rabies Day. So Kasese will now start appearing in the news for the good things. And it's good you came to witness that Kasese is now in a different trajectory, and you can see how the town is very clean now. So all these are things which we want you to come and see, and then you tell the world that now Kasese has changed. And all these functions really not only handle what they are intended to, but they also promote our Kasese. I'm happy that you have come for a preventive exercise, because I think we would be saving a lot of money if we concentrated on prevention. Now that you have come to vaccinate, I'm really happy, because I am looking here at the figures, the amount of money we are spending on treating rabies patients, the people who have been bitten by dogs. It is a lot of money. We can save this if we vaccinated these dogs. I also didn't know, I'm now learning, that you can also prevent rabies by family planning of dogs, reducing all the numbers. That is a new preventive measure that I have learned here today. But if that is the case, then I support it. What the doctors want of dogs. I'm now also learning that. But I would like to thank all the development partners who I have seen around 15. It's the first time I'm seeing 15 partners coming together to really combine efforts to fight something. So I think if you can move like that, we are going to eliminate rabies. But I would also like to emphasize, I'm happy that the commissioner from Ministry of Health has hinted on it. The policy of One Health, let us fast track it. I was a mayor of this town for about 10 years. And we were trained, we went for so many workshops and seminars in Fopoto about One Health, but it's not taking off. And because we want to work in silos, everybody wants to pull something, and I think it is one of the best policies that can eliminate all these things. Because now you can see there is anthrax now outbreak in Kanungu, but when they trace it, they are tracing it from Queen Elizabeth National Park, the hippos, and now it is becoming a Ministry of Health issue, and yet it started in what? In the national park, which was Ua. But I think we are, and now eventually veterinary has come in now, agriculture, to go and what? And vaccinate and the like. Why don't we fast track the One Health policy so that we work together, combine efforts, and see how we can fight all this. So this rabies has firmly established itself in Uganda and is spreading its dark shadow to nearly every corner of the nation. Because nowadays you meet so many complaints, so many incidents of rabies. And I think the best we can do is to put a lot of effort under One Health and see how we can stop this spread. Otherwise, it's a devastating disease. Economically, obviously, when you are bitten by a dog, now you are telling me 100% chances that you will die if the symptoms start appearing. Death is one of the economic problems that you can only get, because and then disease, because it incapacitates your capability to work. So as government, we are going to work closely with all the partners to see that we really eliminate this. And with Makerere, nowadays we are supporting a lot of research in vaccine. And when you go worldwide, universities, most of the countries which are developed are using universities for research. The biggest problem we have here is that even when we put money in research, what next after research? We are doing a lot of innovations, but developing those innovations and commercializing them is still a big problem. But you can see now how we are very serious about innovations. Kira Motors, you know the origin, it's Makerere University. Now we put money in vaccination. Recently, the president was telling us there is, I think, you have developed a vaccine, anti-tick vaccine, something like that. And we are waiting, and it is one of the best. So we are waiting for all these innovations to reach development stage and then commercialization. So, as government, we are going to put more money in some of these. We must also develop and commercialize them, and that one we are going to do. So me, I am really very happy, and I thank all the partners, NDA, who have supported enough. Even all these vaccines and whatever, we are giving you a lot of money, but you still need more. Because the Wakanda say, when they give you first put in the and they say now more. So I know that's what you want. But as government, when we improve, when our basket improves, we are going to give more money. And you should also know that our government now has 4 sectors we are concentrating on: commercial agriculture, industry, services, and ICT. And in the commercial agriculture, it is both plant and animal. And now that we are getting more orders in that sector. We have put a lot of money in PDM now to improve agriculture. So we are going to put more money in the NDA and other organs which really work on certification of drugs. I'm happy that the chairman of Veterinary Association has hinted on a system. I think International Veterinary Management Information System to assist people to get the right drugs. That is very important. Actually, the biggest problem that we have in this country are fake drugs. And if you can really streamline that, we shall support you 100%. People are buying drugs for ticks, they are buying drugs even for other diseases, and they are fake. So if you can really streamline that through that system, you tell people where to buy the drugs, it will be okay. The dog clinic which the chairman was talking about, I don't think government can set up a public dog clinic. I've never seen it anywhere. I don't know when it's there. But even in the developed world, I've never seen a public dog clinic. But now we have so many veterinary doctors who come from this area. You know, Kasese is a very funny place where education came late. You can imagine, I think by 1980, around 1986, we only had one veterinary doctor. One like this. I think it's Dr. Mukisa. I strongly believe must be Dr. Mukisa. So it's now that we are coming up with it. You may meet, my sister here might be the second generation of veterinary doctors with the husband. So we didn't have many. I think that's why we don't have even a dog clinic or any clinic or veterinary clinic around. So the best you can do, now that we have many, let one of you come up with a business. Kibaya, you start business, and even when you're in the civil service, you start a dog A dog clinic. For us as government, we can only provide money for vaccines. We are on prevention mainly on the veterinary side. But when it comes to treatment, normally it is entirely entirely private. So my chairman, encourage we now have so many guys who have completed. And you know, veterinary medicine is very, very complicated. When I was in Makerere, I was with someone who studied the veterinary medicine for 8 years. 8 years. They were 4 years those days. But you go and live in Makerere, you come for masters, you leave, he's still studying. so it was 8 years. He had become a permanent resident of Livingstone Hall. Every person would say, I left here this guy. And he was studying veterinary medicine. Because those days, you'd be allowed to repeat once. So you'd be allowed to repeat one more time. So every year, he repeated it. So he spent 8 years studying veterinary medicine. So when someone says it's a very difficult course, I understand. Because it is indeed difficult. I witnessed someone studying for what? For 8 years. And they are the most affected. I'm also surprised, I didn't know this, that actually the children are the ones who love the dogs. Because when you see most of the people, you see a kid holding a dog like a very, very important thing. So that is something which I've learned today, and it's a very great experience. But I would like to tell you that as government, we love these outreaches, and we thank the partners for partnering with us. You know, when you come, FAO and whatever, and join this vaccination, you are doing government work. So we have to really thank you. And lastly, I thank you for choosing Kasese as a day for celebrating this day. You can come and even celebrate it here next year. We shan't. It doesn't cause any constipation. So you come every year and celebrate here, so that you vaccinate more and more and more dogs. And I would like also to to support the chair. We are going to assure the 92% is also vaccinated. I will assure I work with you and we see that we get more vaccines. Since now I have my friends from agriculture here and the NDA, I will assure I do that. I thank you very much for coming, and please don't go. I know you still have some per diem, spend it around so that people can get the benefits of the day. And you can also visit the national parks. Tomorrow the exploration Rwenzori is on. Tomorrow you can join the exploration. They will enter Mwea free of charge, and they will have a boat cruise. So now they are in the Rwenzori mountains, they are coming to sleep here, they go to Mwea. So please stay here so that you can spoil the people here with some little coins, and then tomorrow you go through Mwea to Kampala. I thank you and I wish you all the best.
Yes, sir, Bwana Chief Guest, I want their
we have Kabarole, we have Kamwenge, Rubirizi, Tangwenda.
Ngana mukora t-shirt babira na rembai.
Yes.
Now we have identified different gaps that Kasese have got a number of animals and they need more support for drugs and other entities that may help them. So the struggle will continue to make sure that the activity continue until next year when we shall be rolling out to another district.
Kubanga ebiso bino bibeera naffe bye tulya nabyo bye bikola ki bye birya kati bwe tunaabiragajjalya ne bifuna endwadde enkambwe endwadde ezo zijja komekeza nga zikola ki nga ziri mu ffe ate era tubakubiriza si kujjanjaba bujjanjabi kutuusa mukolo mufune abasawo abakugu ab'ebisolo okujjanjaba ebisolo kuba abo bamanye eddagala ettuufu ery'omutindo ate eriwonya gye likola ki gye liva.
2 years ago, human died of rabies. And in this year, and in 2003, we had 2 dogs died of suspected rabies. Last year, that's 2023, 201 human were bitten by dogs and reported to the health center.
Always affected are the vulnerable people. We have a people that is vulnerable as a result of this, especially the young ones are always affected, the elderly and the women, then the disabled. They can't run in case of a problem, especially when a dog is astray. So after looking at this, thank you very much for this. Again, I appreciate the government for this activity.
Finish. Eh? Don't be scared. Don't be scared.
Entertainment.